A long line of ambulances queued outside a New York hospital, and officials say the peak of the pandemic has still not been reached. It's not expected to hit the city for several more days. Against the backdrop of the most deadly day since the virus hit the US, President Trump continued his feud with the World Health Organization, accusing it of initially minimizing the threat of the virus and responding sharply to that agency's Director General, who said that politicizing the virus could lead to more body bags.
When you say more body bags, I think we would have done, and he would have been much better serving the people that he's supposed to serve if they gave a correct analysis. I mean, everything was, I said, China-centric. Everything was going to be fine, no human to human, keep the borders open. He wanted me to keep the borders open. I closed the borders despite him, and that was a hard decision to make at the time. We were all together. We made a decision against the World Health Organization. I can't believe he's talking about politics when look at the relationship they have to China. So China spends $42 million, we spend $450 million, and everything seems to be China's way. That's not right. It's not fair to us, and honestly, it's not fair to the world.
At this point, we're reevaluating our funding with respect to the World Health Organization. Now, this is very consistent with what President Trump said since the beginning of his campaign. Organizations have to work. They have to deliver the outcomes for which they were intended.
President Trump continued to endorse the use of the anti-malaria drug hydroxychloroquine, ignoring the warning by many specialists that unsourced medical advice could prove dangerous.
Zinc, they say, zinc. You should add zinc. Now, it's all has to be recommended by doctors, physicians, but they say zinc. I want to throw that out there because that's where they seem to be having the best result.
And while the president was volunteering anecdotal medical advice, New York City continued its preparations for what is to come. Volunteers setting up a field hospital in a downtown church, hoping against all predictions that it will not be needed. Mike Hanna, Al Jazeera, Washington.